Welcome to VetCare, your channel for practical veterinary knowledge. Today, we'll talk about an important group of veterinary drugs, NSAIDs. These medications are used to control pain, inflammation, and fever in animals. In this video, you'll learn how NSAIDs work inside the animal's body, their main effects, benefits, and possible side effects, the different types of NSAIDs with key examples, and which ones are safest for use in veterinary practice. So, what exactly are NSAIDs? The term stands for nonsteroidal anti-inflammatory drugs. These are used to reduce inflammation, relieve pain, and lower fever, all without affecting consciousness. They are most effective for mild to moderate pain, such as joint pain, muscle aches, or skin injuries. However, they are usually less effective for deep, sharp visceral pain like that from internal organs. Before we understand how NSAIDs work, let's quickly review the body's natural response to injury, because that's the foundation of their mechanism. When injury, trauma, or infection occurs, the body responds by releasing an enzyme called phospholipase A2 from damaged cells. This enzyme acts on the cell membrane to release a fatty acid called arachidonic acid. This arachidonic acid then serves as the starting point for three main pathways: COX-1, COX-2, and lipoxygenase, also called LOX. COX-1 is always active in the body. It helps produce prostaglandins that protect the stomach lining, support kidney function, and assist in blood clotting. COX-2, on the other hand, is produced mainly at sites of inflammation. It leads to prostaglandins that cause pain, redness, swelling, and fever. The LOX pathway leads to leukotrienes, which also play a role in inflammation, but most NSAIDs do not block this pathway. Now, here's where NSAIDs come in. NSAIDs work by blocking the COX enzymes, especially COX-2. This reduces the production of prostaglandins, leading to less pain, swelling, and fever. However, most traditional or non-selective NSAIDs also block COX-1, which means they can reduce the protective prostaglandins too. This may lead to side effects like stomach ulcers, kidney damage, and reduced platelet function. Some modern NSAIDs also block the LOX pathway, which helps reduce leukotrienes and further control inflammation. The pharmacological effects of NSAIDs include four main actions. First, they provide analgesia by blocking prostaglandins like PGE2 that make pain worse. Second, they offer anti-inflammatory effects by reducing immune cell buildup and fluid accumulation at inflamed sites. Third, they work as antipyretics, but only during fever, by blocking prostaglandins in the hypothalamus, which helps lower the body temperature. Finally, some NSAIDs act as antiplatelet agents. Now, let's talk about how NSAIDs behave inside the body, their pharmacokinetics. Most NSAIDs are weak acids and are well absorbed when given orally. However, they bind strongly to blood proteins like albumin. If an animal has low albumin or is taking other protein-bound drugs, toxicity risk may increase. NSAIDs are mainly metabolized in the liver and excreted in urine or feces. One important note: cats have limited liver enzymes and cannot break down most NSAIDs properly. For this reason, only the injectable form of Meloxicam is FDA approved for cats. Despite their benefits, NSAIDs can cause several side effects. These include vomiting, diarrhea, gastric ulcers, kidney or liver damage, and central nervous system depression if overdosed. It's also crucial to be aware of drug interactions and precautions. Never use NSAIDs together with steroids like glucocorticoids. This increases the risk of serious stomach ulcers. Also, be cautious when combining NSAIDs with other protein-bound or liver-metabolized drugs like warfarin or anticonvulsants. Using NSAIDs with aminoglycoside antibiotics can also increase the risk of kidney damage. Avoid NSAIDs use in dehydrated animals or those in shock. Now let's look at how NSAIDs are classified. They fall into three main categories. First, non-selective COX inhibitors. These include meloxicam, phenylbutazone, flunixin, aspirin, ketoprofen, and meclofenamic acid. Second, selective COX-2 inhibitors. These include daracoxib, Firocoxib, and Robenacoxib. Third, dual COX and LOX inhibitors. The main example is Tapoxolin. Let's now take a quick look at some of the most commonly used veterinary NSAIDs, their uses, and safety notes. Aspirin is occasionally used to manage pain and fever in dogs and horses but should be used cautiously due to its irreversible COX inhibition. It is toxic to cats and not recommended for them. Sulfonamic acid is used in livestock, primarily to treat fever and mastitis. It has mild COX-2 selectivity, making it relatively safe in food-producing animals. Meclofenamic acid is used in horses for arthritis and laminitis. It also blocks prostaglandin receptors, offering additional anti-allergy effects through leukotriene control. Phenylbutazone is commonly used in horses for lameness and inflammation. It is contraindicated in food animals due to drug residue risks. Flunixin meglumine is widely used in horses and cattle for colic, endotoxemia, and fever. It is long-acting in horses, providing sustained pain relief and systemic anti-inflammatory effects. Carprofen is used in dogs for osteoarthritis and postoperative pain. It is preferentially COX-2 selective, reducing gastrointestinal side effects. Atodolac is a COX-2 preferring NSAIDs used in dogs for chronic joint pain. It may reduce tear production and requires monitoring for signs of dry eye. Firocoxib is a highly selective COX-2 inhibitor used in dogs for osteoarthritis. Its high selectivity reduces gastrointestinal risk and improves long-term safety. Meloxicam is approved for both dogs and cats for postoperative pain and chronic inflammation. In cats, only the injectable form is considered safe. Repeated oral use should be avoided. Tapoxolin is used in dogs for osteoarthritis and allergy-related inflammation. It inhibits both COX and LOX pathways, lowers ulcer risk, and is relatively safe even if overdosed. Robenacoxib is used in dogs and cats for post-surgical pain and osteoarthritis. It has a short plasma half-life but accumulates in inflamed tissues, providing targeted, long-lasting action. If you found this video helpful, please like, comment, and subscribe to VetCare. Don't forget to hit the bell icon so you don't miss our upcoming videos.